April is National Minority Health Month. It's a countrywide initiative to highlight the need for improving the health of racial and ethnic minorities in an effort to reduce health disparities.
And we are 2 days away from the start of Black Maternal Health Week. News 8's Amanda Porter spoke with two local doulas about the importance of the week-long initiative. She joins us live in the studio with more. Amanda?
Black Maternal Health Week begins Thursday and runs through the 17th, but it's never too early to learn about the state of birthing in America and the options you have.
You have choices in your birth, and your voice matters.
I've come across quite a few people who just didn't realize what their options were, how to go about deciding those options.
Liana Moore is a doula in Grand Rapids who has been working to support and educate Black and brown people about the complexities of giving birth in America. According to the governor's office, in Michigan, Black women are 2 times more likely to die from pregnancy-related issues than their white counterparts. It's a dark reality for Black women.
If one group of people is not experiencing the same equitable treatment, then it's not fair to anyone. And by addressing those issues and doing implicit bias training and knowing what the numbers are and being honest with yourself, it really is the first step in making a huge impact in that.
Doulas have been growing in popularity.
I'm there with them to go through their birth plans, to talk to them about what they want their birth to look like.
People like Moore and Brianna Trammell are focusing on decreasing the disparity through organizations like More to Love Doula Services and Sprout and Blossom GR. Black, Indigenous, and people of color in Grand Rapids can look into their Birth Equity Fund.
Our Birth Equity Fund was created, one, so that our BIPOC families in the Grand Rapids area could have services more accessible to them for price. So what it allows is for a supplemental sliding scale.
Trammell provides birthing support and postpartum care.
It gives them the advocacy in their space so that they feel empowered, not only for their voice to be heard, but also for them to achieve the birth outcome that they so desire and wish for.
Change starts with education.
Until our system and the way our society works, the way they see birth and the way they see BIPOC families changes, support is needed in those spaces. People need to know that when BIPOC families speak up about something, that their voice needs to be heard, that they need to be respected, and they need to be treated like human beings.
Giving life is a great task, and it shouldn't be dark or draining. There are options and local resources for Black and brown women who are birthing the next generation.
First, get connected with those who are either in the birth work space or people who are firm on advocacy. Our expertise is in advocacy, is in informational support. It's in all of the things that sometimes get overlooked with our standard of care here in the United States.
The Birth Equity Fund has served 11 families so far. To donate to it and for more information on Black maternal health and resources for BIPOC mothers, visit this story on woodtv.com.